A lot of patients don't take their medications as prescribed due to cost issues, and this isn't unique to the uninsured. With private insurance, even a modest copayment can cause people to skip drug doses. That's the topic of this week's Healthcare Triage. There's a logic to out-of-pocket medical payments. They're supposed to make patients think twice before spending money on unnecessary healthcare. When it comes to drugs, however, they're often preventing people from getting necessary care. A recent data brief from the National Center for Health Statistics said about a quarter of adults who had diagnosed diabetes asked their physician if there was a lower-cost medication they could try, even if things were working for them. 13% of them had not taken their medication as prescribed because of the cost. Some of these patients were uninsured. More than a third of such patients had not taken their medication as prescribed because of the cost. That was also the case for about 18% of those with Medicaid. What might be surprising, though, is that 14% of patients with private insurance went without their medications as well. A study in diabetes research and clinical practice last year examined data on cost-related skipping of diabetes medication. They found that more than 16% of those with diabetes engaged in this practice. Those who use insulin and those who earn less than $50,000 per year were more likely to do so. Such behavior isn't localized to diabetes. Multiple studies have shown that when more cost sharing is involved, patients are less likely to stick to drug therapy. This is true when considering birth control, as well as the treatment of high cholesterol, high blood pressure, and other chronic care medications. It's even true in cancer. Before the introduction of tyrosine kinase inhibitors, or TKIs, patients with chronic myeloid leukemia could expect to live 5 to 6 years after diagnosis. These medications, taken orally every day, can lead to full lifespans. They're costly, however, and need to be taken for the rest of a patient's life. In 2013, Stacy Dusetzina, an associate professor of health policy at Vanderbilt University School of Medicine, and colleagues published a study in which they looked at healthcare plan claims from 2002 through 2011. They wanted to examine adults who had CML and who initiated therapy with imatinib, the first tyrosine kinase inhibitor. They were all patients with private insurance. The researchers found that patients with relatively higher monthly copayments, about $53, were more likely to discontinue therapy within 6 months than those with lower copayments, 17% versus 10%. Stopping the therapy can lead to recurrence or even death. One of the biggest concerns about cutting back on medications due to cost is that some medications only work well if you take them exactly as prescribed, Stacy told me. Even worse than that, in some cases, if you take only part of what you're prescribed, your disease can change so the drugs no longer work for you. This can happen in the type of cancer that imatinib and other TKIs are used to treat. More than 8% of all Americans between 18 and 64 have not taken medications as prescribed because of the cost of them. Even 6% of those with private insurance haven't taken recommended drugs because of what they still had to pay. This is mainly an American problem. A study published in BMJ Open compared rates of cost-related skipping of drugs among people 55 and older in 11 high-income countries. Most countries had a prevalence lower than 4%. The second highest rate was in Canada at 8%. This was still less than half the prevalence we see in the United States at almost 17%. Canada's single-payer system is sometimes held up as the preferred other model to the American status quo, but its drug coverage isn't so good compared with the rest of the world. Pharmaceutical coverage is not part of Canada's Medicare system and differs from province to province. Still, Canadians do better than Americans. A study in clinical therapeutics about a decade ago specifically compared the rates of cost-related non-adherence in the United States and Canada. Uninsured Americans were 7 times as likely to skip doses of medication. Those with public or private insurance were still more than twice as likely. Insurance isn't enough, it seems clear. In 2015, researchers published a study in the Journal of General Internal Medicine that looked at medication adherence and cost-saving strategies of those who have Medicare. About 40% of this population took actions to try to cut their costs. Some are relatively innocuous, asking for free samples, for example. But more than 3% of those surveyed admitted to buying their drugs from another country, and almost 3% bought drugs over the internet. Almost 13% split their pills or took less than the prescribed amount to make medications last longer. But this is not how medications work. With many drugs like imatinib, it can even make things worse. Most of the discussions around the cost of drugs focus on the extreme amounts that the system will have to pay drug companies so that people can get them. Relatively few discussions focus on the relatively smaller amounts we still require of patients to receive them. These smaller amounts are still a major barrier to care. Dr. Dusatzina again. Unfortunately, we as a society don't do a good job of making it easier to afford care with clear benefit and harder to pay for care that's more questionable. If we weighed those trade-offs more, I think we could get to a place where drugs that worked were affordable for patients and companies were paid for their very high-value products. Cost sharing is supposed to lower spending without sacrificing quality. It was not meant to prevent patients who need drugs from receiving them. Hey, did you enjoy this episode? You might enjoy this other episode on regulating drug prices. Another thing you can do to help out the show is like and subscribe down below and go to patreon.com/healthcaretriage, where you, like our research associate Joe Sevitz and our Surgeon Admiral Sam, can help make the show bigger and better.